The knee and related structures, chronic and overuse injuries. Tendinopathy in the knee includes patella, quadriceps, and pes anserine tendinitis or tendinosis. Patella tendinitis is also known as jumper's knee. This condition is most common in athletes whose sports involve frequent jumping, such as basketball or volleyball. However, even people who do not participate in jumping sport can get patella tendinitis. Most knee tendinopathy injuries result from overuse injuries. However, they can also be from a direct compressive force. Signs and symptoms typically include dull, achy pain over the tendon, swelling, tendon thickening, and pain that's increased with stretching or active contraction of the quadriceps muscles. In order to manage tendinopathy in the knee, we use Price and NSAIDs. A patella strap, also known as a chopat strap, may help the tendon and change the line of pull for the muscles. An apophysitis injury. Apophysitis are conditions that involve irritation and inflammation of the growth plate and are commonly seen in active children. The growth plates involved in these conditions are called apophyses. Apophyses are cartilaginous growth plates found throughout a child's body and serve as attachment sites for muscles and tendons. Unlike physices, which are growth plates, which are found at the end of long bones that serve as sites for bone elongation or bone growth. When a young athlete participates in an activity or a sport that requires repetitive use of a particular muscle group, such as the quadriceps or the thigh muscle in running and jumping, the weak link is at the cartilaginous attachment site or the apophysis. This tugging on the apophysis will cause microscopic cracks in the cartilage growth plate, leading to inflammation and pain. Another way to understand this is to imagine a cable attached to a screw anchored into a plaster wall. If one continues to pull on the cable, it will crack the plaster at the attachment site and weaken the anchor point. This condition can occur with chronic repetitive tugging on the growth plate, or with one specific event, such as a blow, a fall, or one sudden jump. This is known as the acute on chronic phenomena. Osgood-Schlatters disease is a traction injury which occurs when the patella tendon pulls away from the tibial tuberosity. Sinding-Larsen-Johansson disease is a traction injury which occurs when the patellar ligament pulls on the inferior pull of the patella. Signs and symptoms of apophyseal injuries include pain over the affected site and inflammation. There is typically pain with active knee extension or passive flexion of the knee. An exostosis or a bony outgrowth and an avulsion fracture are possible. The management includes Price and possibly bracing to help support the patella tendon. Osteochondral defects or osteochondritis dissecans, also known as OCD. An osteochondral defect is a type of damage to articular cartilage and underlying subchondral bone. Usually, osteochondral defects appear on specific weight-bearing spots at the end of the thigh bone, or shin bone, or the back of the kneecap. Osteochondral defects can range from a roughened cartilage that causes slight pain, to small bone and cartilage fragments that hinder movement, to even complete cartilage loss that leaves the bones grinding against each other. Osteochondritis dissecans is a joint condition in which the bone underneath the cartilage of a joint dies due to the lack of blood flow. This bone and cartilage can then break loose, causing pain and possibly hindering joint motion. This condition is also referred to as a joint mice and may result in a locking of the joint. Twisting forces combined with direct impact, like being tackled in football, commonly cause osteochondral defects. Sports that put an individual at risk of accidental collision or require quick changes of direction like soccer, basketball, and skiing may put an individual at risk for damage to the articular cartilage. Signs and symptoms of osteochondral defects or osteochondritis dissecans include diffuse pain within the knee, joint effusion, and locking or catching. Management should focus on treating the symptoms of the patient. Surgery may become necessary if it is determined that there are small bone fragments in the joint causing locking. The picture in the center of the slide are different joint mice that have been surgically removed from different patients. They vary in size, but they look a lot like little pebbles. Patellofemoral stress syndrome is also known as patellofemoral pain syndrome. This is a broad term that is used to describe pain in the front of the knee and around the patella or kneecap. Problems with patella alignment or overuse from vigorous athletics or training are often significant factors. Signs and symptoms of patellofemoral stress syndrome include pain around the patella, clicking or feeling like the knee is giving out, and poor patella tracking. Symptoms are often relieved with conservative treatment, such as changes in activity levels or a therapeutic exercise program. This is also sometimes called runner's knee or jumper's knee because it is common in individuals who participate in sport, particularly females and young adults. But patellofemoral pain syndrome can occur in non-athletes as well. The pain and stiffness it causes can make it difficult to climb stairs, kneel down, and perform other everyday activities. Many things may contribute to the development of patellofemoral pain syndrome. Patellofemoral stress syndrome could result from a combination of fat pad syndrome, chondromalacia patella, tendinopathy, bursitis, IT band friction syndrome, or even a plica. Chondromalacia patella. Chondromalacia patella is an abnormal softening of the cartilage on the underside of the kneecap, or patella. It is a cause of pain in the front of the knee or anterior knee pain. Chondromalacia patella is one of the most common causes of chronic knee pain in individuals. Chondromalacia patella results from degeneration of cartilage due to the poor alignment of the kneecap or the patella as it slides over the lower end of the femur. This process is sometimes referred to as patellofemoral syndrome. Patients with chondromalacia patella frequently have abnormal patella tracking, typically towards the lateral or outer side of the femur. This slightly off-kilter pathway allows the undersurface of the patella to grate along the femur, causing chronic inflammation and pain. Certain individuals are predisposed to developing chondromalacia patella, such as females, individuals who are considered knock-kneed or flat-footed runners, or even individuals who have an unusually shaped patella undersurface. Signs and symptoms are often asymptomatic until enough of the patella is worn away. At that point, the patient will then complain of deep and diffuse pain and increased pain with knee extension and compression of the patella. Management should include referral of the patient to receive x-rays or a surgical scope to determine the extent of injury. A knee bursitis. Knee bursitis is an inflammation of the bursa located near the knee. A bursa is a small fluid-filled pad-like sac that reduces friction and cushions pressure points between your bones and the tendons or muscles near your joints. Each of your knees has at least 11 bursa. While any of these bursa can become inflamed, knee bursitis most commonly occurs over the kneecap or on the inner side of the knee below the joint. Prepatella bursitis is a result of continued kneeling. Infrapatella is the result of overuse on the patella tendon. Knee bursitis can be the result of an acute direct blow or from an overuse injury. This condition can be extremely recurrent, meaning it comes and goes. Knee bursitis signs and symptoms may vary depending upon which bursa is affected and what precisely is causing the inflammation. In general, the affected portion of your knee may feel warm, tender, and swollen when you put pressure on it. An individual may also complain of pain when they move or even at rest. A sharp blow to the knee can cause symptoms to appear rapidly, but most cases of knee bursitis result from repetitive injuries sustained in jobs that require a lot of kneeling, so symptoms usually begin gradually and may worsen over time. To manage the condition, patients should continue to use price, NSAID, and possibly the aspiration or a steroidal injection may be necessary. These should only be done under the direct supervision of a physician and in a sterile office setting. IT band friction syndrome. Iliotibial band or IT band inflammation is an overuse syndrome that occurs most often in long-distance runners, bicyclists, and other athletes who repeatedly squat. The iliotibial band syndrome may be the result of a combination of issues, including poor training habits, poor flexibility of muscles, and other mechanical imbalances in the body, especially involving the low back, pelvis, hips, and knees. There can be a predisposition to developing IT band friction syndrome. Anatomy issues may include differences in the lengths of the legs, a leg length discrepancy, an abnormal tilt to the pelvis, or even bow-leggedness, also known as genu varum. These situations can cause the iliotibial band to become excessively tight, leading to increased friction when the band crosses back and forth over the femoral condyle during activity. Training errors may cause runners to develop iliotibial band syndrome symptoms. Roads are canted or banked with the center of the road higher than the outside edge to allow for water runoff. If a runner always runs on the same side of the road, it produces the same effect as the body having a leg length discrepancy. One leg is always downhill compared to the other, and the pelvis has to tilt to accommodate the activity. Running too many hills can also cause inflammation of the IT band. Running downhill especially is stressful on the IT band as it works to stabilize the knee. Bicyclists may develop IT band inflammation should they have improper posture on their bike and toe in when they pedal. The issue may be how the toe clips are aligned, forcing the foot to be internally rotated or toed in. This can cause the same effect as bow-leggedness and increase the angle of the IT band as it crosses the knee and increasing the risk of inflammation. Other activities with increased knee flexion can cause symptoms including rowing and weightlifting, especially with excessively heavy squatting. Common signs and symptoms of IT band friction syndrome include pain over the lateral femoral epicondyle and IT band tightness. Management should include price, NSAIDs, and iliotibial band stretching. Foam rolling, such as what's seen in the picture, is extremely useful in stretching the iliotibial band. Knee plica syndrome. A plica syndrome, also known as a synovial plica syndrome, is a condition when a plica, or an extension of the protective synovial capsule of the knee, becomes irritated, enlarged, or inflamed. This inflammation is typically caused by the plica being caught on the femur or pinched between the femur and the patella. The most common location of plica tissue is along the medial side of the knee. The plica can tether the patella to the femur, be located between the femur and the patella, or can be located along the femoral condyle. If the plica tethers the patella to the femoral condyle, the symptoms may cause it to be mistaken for chondromalacia patella. Plica are sometimes even visible on MRI scans. The plica themselves are remnants of the fetal stage of development, where the knee is divided into 3 compartments. The plica normally diminishes in size during the second trimester of fetal development, as the 3 compartments develop into the synovial capsule in the knee. In adults, they normally exist as sleeves of tissue called synovial folds. The plica are usually harmless and unobtrusive. Plica syndrome only occurs when the synovial capsule becomes irritated, which then thickens the plica themselves, making them more prone to irritation or inflammation and being caught on the femur. Signs and symptoms of plica are pain with prolonged sitting, then a sharp pain 8 to 10 steps when standing and beginning to walk. Popping and clicking may occur. There may be a palpable ridge or a bump over the medial aspect of the knee joint. And some individuals will complain of pseudo-locking, where it feels like the joint can't fully extend. However, if the patient pushes, they can fully extend their knee. The management for knee plica syndrome includes price, NSAIDs, stretching, and possible surgical intervention.